Hi there, my name's Jake and I'm the Pharmacy Technician Supervisor here at Lock Haven Veterinary Hospital. Today I'm joined by Dr. McIntosh and I have just a few questions about cat wellness that we're going to go through. First, Dr. McIntosh, how often should my cat get a wellness exam?
So, Jake, we see cats a lot less than we see dogs for a lot of different reasons, and a lot of them are because of the cat. So we definitely want to see kittens very often. We want to see adult cats at very least once a year. And once they hit a certain age, we certainly want to see them at least every 6 months, because 1 year in a cat's life is like 10 years in a person's life. So if you went to the doctor once every 10 years, you'd certainly miss something at some point.
Is there ever a reason cats will need more than one annual wellness check?
Absolutely. If they've got a chronic problem, if they're having an issue, again, kittens we see very often, so once a month for a little while. Adult cats, if they're really, really healthy and we're not seeing any problems and there's no changes, we can see them once a year. But older cats, we definitely want to see them at least every 6 months.
My cat seems healthy. Does she really need a wellness exam?
Absolutely. Cats are extremely good at hiding illness and pain and disease. And so we a lot of times will miss on our everyday just cuddling and being around a cat, we'll miss that they're having problems. So making sure that they're coming in for their regular physical exams, making sure that we're looking at their eyes, their ears, their nose, their mouth, their teeth, their skin, all of the places that you wouldn't necessarily touch when you're just sitting there cuddling them. We want to look at that when we see them here so that we don't miss anything.
How often does my cat need dental checkups at the veterinarian?
So absolutely, dentistry is a part of every physical exam. We're looking at that mouth, we're looking at the teeth. 80 to 90% of cats by the age of 1 or 2 have periodontal disease. So they have calculus, they have gingivitis, they have issues that need to be taken care of in there. They don't brush their teeth twice a day and they're not going to the dentist every 6 months like we're supposed to. So if we did that to our mouths, we'd have a lot of tartar and we have had a lot of problems too. So we will look at their mouth every time they come in here. At least once a year, we should be at least looking, making sure we don't need to schedule a dentistry. And again, the older kitties more often than not.
Thank you, Dr. McIntosh.
Thanks, Jake.